welcome back to this week's Monday Motivations, brought to you by Gates Brain Health. Dr. Randall Gates is back with us today. He is a board-certified chiropractic neurologist and a chiropractic physician. Here today, we are going to talk about POTS. Now, this is something I really was not aware of. I had to do a little Googling this morning. But you're the expert, so talk to us. What is POTS?
POTS is referred to as Postural Orthostatic Tachycardia Syndrome. So when someone stands up and they're moving around, unfortunately they have blood pooling in their lower extremities. They get a surge of adrenaline from the adrenal gland, which then causes the heart to beat really fast.
So this is different, say, if I'm just sitting down and I stand up very fast and get a little lightheaded.
Right, and that could be analogous to orthostatic hypotension. POTS is different because you get the rebound fast heart rate, simply.
So why is this such an important topic to highlight?
Well, it's really common after viral infections. And you know, we're in the era
we're getting it right and left right now.
So many viral infections from so many angles. And so that's really common. And it's a common cause of chronic fatigue, brain fog, things of that nature.
Okay, so talk to us about some of the symptoms to look for. You talked a little bit about it, but
yeah, so brain fog, dizziness is a big one, fatigue, along with lots of times headaches, lightheadedness. Those are the key sensations. But there can be other components to it as well, such as irritable bowel syndrome type manifestations, so abdominal bloating, gas, pain, constipation, diarrhea. Excessive allergic reactions are being documented now with a lot of POTS patients. So if you have a lot of sensitivities to like perfumes or foods, or even other things like your allergies are getting worse, that can be associated with POTS.
And what brings this on?
Great question. So POTS is a relatively new phenomena in terms of its awareness. The Mayo Clinic did a lot of work on it. And in the last 10 years, the Mayo Clinic has shown that about 89% of the time it's due to an autoimmune condition. So about half the time it's where the immune system is attacking the ganglia coming out of your nervous system that connect your nervous system to your vital organs or your blood vessels. And then 89% of the time it can be immune cells to the adrenaline receptors in the heart. So
as this is becoming more and more aware and on people's radars, is it pretty actually common to have?
It's pretty common in those demographics of people who are experiencing dizziness, lightheadedness, fatigue, brain fog. I would really start to think about POTS if a person is experiencing those symptoms. And it's common with head injuries. So we're now seeing those who don't recover from head injuries, a significant percentage of them have POTS.
Interesting.
And if you correct the POTS, the post-concussion syndrome goes away.
Okay, I want to get back to that, correcting the POTS, but I also want to say, is there any specific demographic, like male, female, older, younger?
POTS tends to be more of a female preponderance.
Okay.
And younger female most of the time. It can affect a lot of people, but mainly younger females.
So you hinted at it, it's correctable.
It is.
How do we fix this?
So the current strategies, it can include medications, it can include volume therapies where you try to have people drink more water, increase their salt intake. There are certain compression activities that we use, like stockings or waist trainers. We do a certain type of cardiovascular exercise because they don't do well exercising standing up. So you have to exercise in a certain position, trying to kind of reteach the heart to communicate with the brain and the lower extremities. And
then eventually it goes away, or the symptoms just don't manifest as well?
For some people it goes away in a year, other people it doesn't go away. And so that's where I see a lot of people who have chronic symptoms who necessitate treatment.
All right, so interesting. I mean, the body is just one evolving conundrum after another. We're constantly
especially
learning
in this era, especially with all the viral infections. So
all right, well,
that's why I wanted to talk about this.
This is a great topic. If you have any more questions about POTS, maybe you think some of those symptoms sound familiar to what I have or someone in my family has, contact Gates Brain Health. They'll be glad to help you out with any more information. Dr. Gates, thank you so much for being here.
Thank you. Appreciate it.
All right, stay with us. We'll be right back.